Greetings, loved ones. Psychological or emotional maltreatment of children may be the most challenging and prevalent form of child abuse and neglect. Psychological maltreatment has been linked with disorders of attachment, developmental and educational problems, socialization problems, disruptive behavior, and later psychopathology. Today we're going to begin a 4-part series and dive in deep to learn about the psychological maltreatment of children. Help us get these messages out, subscribe to our channel, follow us on Facebook, Instagram, and Twitter, hit the like button and the notification bell, and please share these messages with others. You could save a life. So let's get right into psychological abuse. Psychological or emotional abuse of children may be the most challenging and prevalent form of child abuse and neglect. Caregiver behaviors include acts of omission, which are ignoring needs for social interactions, or commission, spurning, and terrorizing. And it may be verbal or nonverbal, active or passive, and with or without intent to harm, and negatively affect the child's cognitive, social, emotional, or physical development. Psychological abuse has been linked with disorders of attachment, developmental and educational problems, socialization problems, disruptive behavior, and later psychopathology. Although no evidence-based interventions that can prevent psychological abuse have been identified to date, it is possible that interventions shown to be effective in reducing overall types of child abuse may have a role to play. Furthermore, prevention before occurrence will require both the use of universal interventions aimed at promoting the type of parenting that is now recognized to be necessary for optimal child development, alongside the use of targeted interventions directed at improving parental sensitivity to a child's cues during infancy and later parental-child interactions. Interventions should first and foremost focus on a thorough assessment and ensuring of the child's safety. Potentially effective treatments include cognitive behavior parental programs and other psychotherapeutic interventions. The high prevalence of psychological abuse in advanced Western societies, along with the serious consequences, point to the importance of effective management. Pediatricians should be alert to the occurrence of psychological abuse and identify ways to support families who have risk indicators for or evidence of the problem. Let's define it. There's no universally agreed definition of psychological abuse or emotional abuse. These are terms that are often used interchangeably. Psychological abuse encompasses both the cognitive and affective components of abuse. Exposure to psychological abuse is considered when acts of omission or commission inflict harm on the child's well-being, which may then be manifested as emotional distress or maladaptive behavior in the child. Psychological abuse is difficult to identify, in part because such abuse involves a relationship between the parent and the child rather than an event or a series of events occurring within the parent-child relationship. Isolated incidents of behaviors identified do not necessarily constitute psychological abuse. Psychological abuse refers to a repeated pattern of behaviors that is likely to be interpreted by a child that he or she is unloved, unwanted, or serves only instrumental purposes or that severely undermines the child's development and socialization. Recent conceptualization of psychological abuse focuses on the caregiver's behaviors as opposed to the disturbed behaviors in the child. Such behaviors of the caregivers include acts of omission, ignoring the needs for social interactions or commission, spurning, and terrorizing, may be verbal or nonverbal, active or passive, with or without intent to harm, and negatively affect the child's cognitive, social, emotional, and/or physical development. So let's look at the different types of psychologically abusive caregivers. There are 6 categories of psychologically abusive behaviors by caregivers. The first one is spurning. Let's talk about that. Belittling, denigrating, or other rejecting of the child. Ridiculing for showing normal emotions. Singling out or humiliating in public. Terrorizing. That would be like placing in unpredictable or chaotic circumstances, placing the child in recognizably dangerous situations, having rigid or unrealistic expectations accompanied by threats if not met. And then there's threatening or perpetrating violence against child or child's loved ones and objects. Another form is isolating. That would be confining the child within a specific environment, restricting social interactions in community or other family members. And then there's exploiting or corrupting. That would be modeling or permitting or encouraging antisocial, developmentally inappropriate behavior. That would be restricting or undermining psychological autonomy. That would be restricting or interfering with cognitive development. Another form is denying emotional responsiveness. This would be being detached or uninvolved, interacting only when necessary. It would be providing little or no warmth, nurturing, or praise during any developmental period in the childhood. Another form is mental health, medical, educational neglect. This would be limiting a child's access to necessarily health care because of reasons other than inadequate resources, refusing to provide for serious emotional, behavioral, physical health, or educational needs. Although the psychological components of any form of child abuse are key to understanding its effects, psychological abuse is often not recognized when other forms of abuse coexist. When psychological abuse occurs alone, it can be even harder to identify, and opportunities for intervention may be missed altogether. This form of child abuse is possibly the most underreported to authorities. Let's talk about the distribution of psychological abuse. A recent review of the burden and consequences of psychological abuse concluded that although there were a few studies reporting its prevalence, a number of large population-based self-report studies in the United Kingdom and the United States found that approximately 8 to 9% of women and 4% of men reported exposure to severe psychological abuse during their childhood. This review found even higher rates reported in Eastern Europe. Several U.S. surveys found that psychological and emotional abuse were the most frequently self-reported forms of victimization. According to the CDC, over half of all children in the world, that's 1 billion children ages 2 to 17, experience violence every year. The question is not if you will encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. Micah 6:8 says, He has showed you, O man, what is good. And what does the Lord require of you? To do justice, love mercy, and walk humbly with your God. You are called. We are all called to be champions for justice. If you're a victim, please listen to me. I want you to know that you are valued. You are loved. You are intelligent and you are worthy. I want you to know that there is a way out and it's not your fault. Abuse is not love. And most of all, I want you to know that you are not alone. If you're suffering violence, reach out to someone today. If you find yourself in a dangerous situation, call 911 for help. If you know of a child or other person suffering violence, tell the authorities. In our next episode, we will continue in this 4-part series and dive in deep to learn more about the psychological abuse of children. Until then, God bless you.